You're watching continuing coverage of the World Healthcare Congress 2012, and I'm very pleased to welcome to the studio this morning Dr. Emad Rizk, President of McKesson Health Solutions. Boy, Dr. Rizk, it's always great to see you.
It's my pleasure. It's nice to see you
Yes,
again.
And I want to mention that you have had this book out in the marketplace that seems especially relevant now. The book, of course, is The New Era of Healthcare: Practical Strategies for Providers and Payers. Now, what changes have you seen this year due to healthcare reform?
That's a very good question. What I've seen actually is the payers and the providers are working much closer together than they've ever done before. I think about 10 or 15 years ago, they would sort of collaborate, but they did not actually work together in a meaningful way. I see them exchanging data, using processes across both the payers and the providers. So as you said, the book that I wrote a few years ago, I did not foresee many of the changes that were coming with some of the healthcare reform, but now have become more and more relevant.
Now, this data exchange that different sectors of the healthcare industry are exchanging, is it resulting in meaningful results?
Well, absolutely, because if you look at traditionally the payers, they have a lot of claim system, and if you claims data, and if you look at the providers, they have a lot of the clinical. If you combine the two, you have a powerful tool in terms of understanding what an individual or a patient, a full picture of what they have. You could look at them, their historical, you could look at their outcomes, so many different things. So I think right now the data exchange between both the financial and the clinical has direct impact of patient outcomes.
And are you seeing that the patients themselves are noticing a difference?
Well, I don't think so. That takes a little bit longer. I think we've had a wave where patients are much more consumer conscious. I think we had the consumer-directed plans and all of this. So I think, generally speaking, healthcare is in the forefront of many of people's thinking. I think the wellness move has really took hold here in America. So I think that the patient themselves are a little bit more aware and accountable than ever before.
We're hearing a lot about accountable care organizations. This seems like the big buzzword this year. I guess there's also timing of the health care law that said we needed to put these into play. Is that correct?
Correct.
Are we on track to provide that kind of organization that people had said would be the correct ones to have?
Well, I think right now we're in a period of experimentation. We're looking at various models that are accountable care organizations, and I think we're doing a little bit in Medicare. We're doing it also the commercial population and the health plans are doing it. And basically the premise of an accountable care organization is to actually make the providers and the payers both share in the outcome for that patient. And I think where we're moving from a paying per procedure or paying per incident or episode to paying for outcomes. So we're now going to pay for value. So I think there'll be different models. We're probably in a 3-year experimentation phase.
3 years. And what about bundled care payments? Who is deciding the pricing of a bundled care?
Well, at this point, it's the payers. So what payers generally will do...
Is that the right way?
Well, I think eventually the first step has to be with payers because they have the retrospective and the prospective view of what a bundle is. But I think once they do that and they price it and they say what's in the bundle and what's out of the bundle, they have to go to the providers, obviously, and make sure that the providers are aligned and sign up for that. So I think we're in the first step. We're experimenting now. I think the next step is going to be going to the providers and working with them.
Any concern that all of the work that we've done in the past 2 years since this law was passed will be derailed because the Supreme Court might rule some of this unconstitutional?
Absolutely not. I think the industry has really moved very quickly. I think we were just in a panel where one member of the panel said the train has left the station. I think the level of traction in the market is really pretty significant. And generally speaking, it's the industry that drives change. I think there is maybe what government might do is ignite a thought, but it's really industry that drives a lot of the change.
And so you don't believe people are in a holding pattern right now?
I don't believe so. I think all accountable bundling, episodes of care, all those risk-sharing models are going to continue forward.
Okay, Dr. Rizk, thank you so much for your time today.
It's always a pleasure.
Nice to see you.
Nice to see you.
I'm Mabel Jong. Thanks for watching.